This idea really originated sitting in a room in Delhi with a doctor who said, Dr. Garg, you have to start something where individual effort can be made to lower the burden of diseases. So we looked at it, and biggest thing was chronic diseases in our population. So we thought, and I thought, that it would be good to start an organization which can lower that burden of disease and at the same time build links between Canada and India. It also had an economic oversight. By building the links, we could increase trade, we could increase economic activity, so we created Canada-India Network Society. So we started with the focus activity around cardiovascular disease. So we were able to engage most of the leaders in cardiovascular disease in India and in Canada. That was a meeting we organized, Canada-India Network Initiative 2010. And main focus of that was to make awareness of such a high preponderance of chronic diseases like coronary artery disease, heart disease, diabetes, hypertension, kidney disease among South Asian population. So the biggest idea which emerged in 2010 was that we have a problem in our own backyard, and the problem of the burden of this disease is as large here as it is anywhere else. So idea started to emerge, or recommendation came at that conference that we should engage Fraser Health in a meaningful way to start to look at this issue so that we could lower the burden in our own backyard. So that was the biggest recommendation, or should we say outcome, which we then were able to focus from further developing. The biggest discovery in my mind was that there is a real problem, and problem is in our own backyard. So best relationship CINS could develop would be with Fraser Health. So working with Fraser Health senior executive, idea of SAHI was finalized, South Asian Health Institute. So South Asian Health Institute then was inaugurated in 2013. And it's a virtual organization to carry on some of the vision which Canada-India Network Society had. Health, human resource planning, there was a real need and recognition by Government of India that they need to plan. And this is where we were able to land my own field on allied health. So British Columbia Institute of Technology, which is a premier institute, we were able to connect them with Public Health Foundation of India and Government of India in their human resource planning. So 2014 then became focus of that activity. So we have designed again from ideas to action, and the three areas which we have identified in chronic diseases are chronic disease around diabetes, mental health addiction, and palliative care. We have partnered with the BC Palliative Center and Dr. Sutcliffe, who is doing a lot of work on India, so we're bringing India and Canada together. Mental health and addiction, our own Fraser Health has a clinic, a Roshni clinic, so we will be bringing that out. And for diabetes, as I mentioned, our own people, Fraser Health, Sehat program, and several other physicians who are working in this area in an innovative way. But combining all this is through certain tools. And we have identified technology as the biggest player which will make a difference. So technology, engaging patients, engaging them on a 24/7, 365 days will be the next frontier in terms of mobile technology, in terms of apps, in terms of patient using those and then connecting in their own care will be all featured.